All right. Welcome, everybody. I am Alexandra Santa Maria, and today we're going to talk about heart health in women. So a little bit about me. I'm a doctor of pharmacy. I'm also the founder and CEO of RX Health and Wellness. I'm also a diabetes care and education specialist, and I am a functional medicine practitioner, and I specialize in cardiometabolic treatments. So functional medicine is conventional medicine that goes beyond conventional medicine. They also embrace holistic approaches, and they want to find the cause or the root cause of the problems. So diabetes, for example, is the name we give a set of symptoms that you have, but it's not the cause of the high sugars. So finding the root causes where we hopefully can reverse diabetes. And cardiometabolic refers to any conditions that are related to your heart and blood vessels. And also metabolism refers to the way your body uses energy. So that is a whole lot of different conditions that we cover, anything from heart failure, PCOS, diabetes, pre-diabetes, high blood pressure, and so on. Okay, so today let's talk about heart health. So February is Heart Health Awareness Month. And we're going to talk about women because the symptoms of heart attack present completely different for women, and a lot of times are missed when they go to the emergency room. So I want you to be aware of what they are, and also what things that you can do to keep your heart healthy. All right. So heart disease is the leading cause of death in the United States for both male and females. And stroke is the 5th leading cause of death in the United States. And they're very, very much related. So having heart disease increases your risk for strokes. And heart disease is the leading cause of death in women in the United States. Women are more likely than men to have heart attack symptoms unrelated, like chest pain, which is the typical symptom that you get. Usually they get more like neck and jaw pain, upper back, upper belly, abdominal discomfort, shortness of breath, maybe pain in one or both arms, usually presents more to the left. Nausea and vomiting, sweating, lightheadedness, unusual fatigue, and heartburn. Okay, so these are the risk factors for heart disease. 90% of women have at least one risk factor, and they're diabetes. Women with diabetes are more likely to develop disease than the men who have diabetes. Also, because diabetes can change the way women feel pain, there's an increased risk for having a silent heart attack, so not having any symptoms at all. Emotional stress and depression. Stress and depression affect women differently than men. Depression may make it more difficult to maintain a healthy lifestyle and follow the recommendations from their doctor. Smoking is a greater risk, again, in women than in men. Lack of physical activity or inactivity is a major risk factor for both men and women. Menopause. Menopause is a big one for women. So low levels of estrogen after menopause can increase the risk of developing diseases in the smaller blood vessels, which increase then your risk for having heart attacks and strokes. All right, high blood pressure in pregnancy. When women have complications in pregnancy, like high blood pressure or diabetes, can increase the long-term risk for the mother and also for the baby. These conditions can make women more likely to get heart disease. So again, pregnancy complications is a big one for females. Family history of early heart disease. And again, this is a greater risk in women than in men. So for example, my grandfather died at a very early age of 50, and he had of a heart attack, massive heart attack. So heart disease runs in our family. Inflammatory disease, things like rheumatoid, lupus, and other inflammatory conditions can increase your risk for heart disease. But keep in mind things that are cardiometabolic in nature are due to increase insulin, which increases your inflammatory state. So all of those can also increase your risks. All right, 80% of deaths from heart disease are completely preventable. So what do we need to do? We want you to know your numbers. Okay, the first number that you should know is blood pressure. So your blood pressure should be under 120/80. I know most of us will go to the doctor, and if our blood pressure is around 130/85, they're not going to say anything. They'll just keep an eye on it. Once the blood pressure goes about 140/90, then they'll start treatment. But the truth is, blood pressure of say 130/85 has doubled the risk of heart attack compared to the blood pressure under 120/80. That's why it's important to know your blood pressure numbers and get checked every time you go visit your doctor. And if your top number, that's the systolic number, is above 120, like around 130, then you need to start making some changes to your lifestyle in order to bring that number down, such as cutting salt out of your diet, eating a healthier diet, and exercise. Cholesterol. So total cholesterol number should be under 200. HDL should be above 50 for females, and triglycerides should be under 150. Now, in the past few years, a lot of doctors have been talking a lot about the bad cholesterol, or the LDL. And we know driving the LDL down decreases your risk, but you can still have heart attacks and strokes when your LDL is less than 70. So there's something else going on. So in a 2017 study of the Journal of Diabetes Care, for example, they found that people with triglycerides that are higher than 150 and an HDL that's lower than 50 had about 1.3, or almost double the risk of heart attacks disease compared to those who had normal triglycerides. And in functional medicine, we actually would like those numbers to be much, much lower. We want your HDL certainly above 50, but we want your triglycerides lower, like in the 130s, and total cholesterol also like around 180 or 160 or so. All right, blood sugar. So your fasting blood sugar should be less than 100. Diabetes, so that's that disease in which your blood sugars are really high, is a major contributor to heart disease. That's especially true for women, more so than men. If they have diabetes, they have 40% greater risk of developing heart disease, 25% greater risk of suffering strokes, more so than men. So controlling blood sugars is very important. We know that about a quarter of the people who actually have diabetes are walking around not knowing that they have diabetes. So knowing your blood sugar numbers. And if you have family members who have diabetes, especially type 2, we're talking mostly about type 2 diabetes, then you should be asking your doctor if you need to be screened for diabetes. Waist size. So this one is a big one. Women whose waist circumference is over 35 inches are almost 1/3 more likely to die of heart disease than those whose waist circumference is less than 35, according to a study published in July of 2019 in the Journal of JAMA, which is a very high prestigious journal for medicine. That's because the fat around the abdomen, known as visceral fat, increases your inflammatory substances, so inflammatory states that hikes up your blood pressure and even your blood sugar. So remember, we talked about inflammation. So having a big waist circumference increases those inflammatory states. Exercise. So again, the recommendation here is 150 minutes of moderate intensity exercise. But moderate intensity is when you're able to still talk while you're exercising. If you are not able to talk at all, then you're at high intensity. And if you're able to sing while exercising, then that's low intensity for you. So only 1 in 5 women get about 150 minutes of exercise per week. That's according to the American Heart Association. So women more so than men seem to be busier taking care of their families, work, whatever it is. So they tend not to do the exercising. Sorry, it's very windy in here. Resistance training is also key. So lifting weights for less than an hour a week, so 30 minutes, 2 days out of the 7 days, would reduce your risk of heart attacks and strokes by about 70%. And that's according to a study published in 2019 in the Journal of Medicine and Science in Sports and Exercise. So 30 minutes twice a week. Inactivity, there's your couch potatoes. So the recommendations is to stand for about 2.5 hours out of the 8-hour work day, or whenever you're just sitting for long periods of time. So exercise along. So like say you exercise for 30 to 60 minutes every day, but then the rest of the day you spend it on the couch. That's not gonna do the trick for you. So even just standing at your desk will help. In a study published in 2016, it was found that people with high blood pressure standing for at least 2.5 hours out of their 8-hour workday were able to lower their blood pressure by as much as 5 points. So make sure you stand up and walk around. Sleep. So sleep is a huge one. Women need at least 7 hours of sleep per night. If you don't get enough sleep, you're setting yourself up for heart problems. And unfortunately, women do this a lot, either because they have children, stress, whatever the reason. So we know that having little sleep causes all your body functions to be thrown off balance, which can lead to high blood pressure, high blood sugars. In one study published in 2019 in the Journal of the American Heart Association, it was found that middle-aged women with high blood pressure and at least with or without type 2 diabetes who got less than 6 hours of sleep at night had a risk as high as twice as much for dying from a heart attack or a stroke than those who slept longer. So sleep is very important. Decreased sleep also affects your body's immunity, so the ability to fight illnesses, colds, viruses, and things like that. So sleep is very, very important. A diet low in vegetables and fruits. So the recommendation is 5 to 7 servings of fruits and vegetables every day. These foods are all high in potassium, magnesium, and calcium. Those are nutrients that your body needs. They can help you lower blood pressure. In a 2017 study of more than 400 adults with high blood pressure, it was found that a combination of a low salt diet with a DASH diet, that's a diet that's very similar to the Mediterranean diet, high in fruits and vegetables, lower blood pressure as much as taking medication for blood pressure. Stress. Stress causes your brain to release cortisol, which is that hormone that we release when we feel threatened. So the fight or flight hormone. But unfortunately, cortisol can increase your levels of cholesterol, also your blood pressure, and even your blood sugar. It also promotes plaque to build in your arteries. In one study of over 17,000 women, it was found that those who work in highly stressful jobs had an increase of about 40% for heart disease compared to those who didn't rate their job as being highly stressful. But we also know that the issue is more than just stress itself. It's how you handle stress. So hopefully you saw in the Facebook group, the posting I put about mindset and how you perceive stress is also very important. So if you feel stress or overwhelm, take a 2 to 3 minute pause and do some deep breathing. So let's watch this video.
Experience feelings of stress or anxiety. In these moments, you can use your breath to help calm those feelings. Box breathing is a simple relaxation technique that can help you reset your breath and return to its normal rhythm. You can do it anywhere, anytime. Box breathing can help reduce stress and improve mood. It can also help with controlling and managing emotions. It's very easy to learn. Imagine breathing around a box. Inhale as you visualize going up one side of the box, gradually filling your lungs with air. When you reach the top, hold your breath for 1 to 5 seconds as you picture going across the top of the box. Exhale gradually as you imagine traveling down the other side of the box. Pause again for 1 to 5 seconds as you go along the bottom of the box. Then repeat. This can be done 7 to 10 times in a row, focusing on the breath. If you can do it sitting down with your feet grounded, that will help too. But really, it can be done anywhere. Box breathing has physiological and psychological benefits. Physiologically, it regulates breath, increases oxygen to the lungs, and can help reduce blood pressure and lower heart rate. Box breathing can help psychologically by providing focus to your breath and removing attention from the things that are causing feelings of stress and anxiety. The repetition of box breathing can also help reduce stress. So, in moments when feelings of stress and anxiety are overwhelming, remember box breathing and the power of your breath as a simple way to relax and breathe a bit easier.
All right, so that's the presentation for today. Let me know if you have any questions. I am going to be posting the video over in the group. Hope to see you next month. I posted the dates for the next ones, so I hope to see you there. Take care.